Welcome to our open online briefing. I'm sitting here a little bit with my smart suit on because today was the day of the World Health Assembly. The second day, actually, and it was a most unusual World Health Assembly, and I want to talk to you about that. I also want to bring on board this time some of the issues that I feel still are not fully understood by governments all over the world. And I'm really going to ask for your help as I offer this briefing as to how we can spread the word more. So the idea today is a relatively short introduction by me and lots of space for you to put comments in, and we'll try also to have short inputs from you if you like. Just answering one core question. How can we further enable governments everywhere to understand that releasing lockdown is not safe if the basic public health services to defend against the virus are lacking? So it's not a choice of health versus the economy. It is get the basic health services right, then the economy can restart. But if those services are wrong, just not working or designed badly, then things will become difficult again. And that will have terrible social and economic consequences everywhere. So that's going to be my theme, but let me just tell you a little bit about the World Health Assembly and what's going on, because that's very much the center of my discussion today. Every year, the member states, that's the governments of the world and a few others who own the World Health Organization, come together and they basically set the rules. They also check to see that things are going well. They're like the kind of board of directors for the World Health Organization. The organization itself has a director general at the top who's responsible for everything. And then there are about 7,000 staff. Mostly they're in public health, but they're not all doctors and nurses. There are logisticians, there are administrators, there's security personnel. There are people who basically keep the whole place going. And these 7,000 staff work in just over 100 offices in countries everywhere. They also run various programs around the world, disease control, prevention, and the like. And they also have 6 regional offices in 6 strategic locations, and then a headquarters in Geneva. And that's the Secretariat, 7,000 people. Its budget, well, it's about $2.2 billion a year. That's about 1/3 of the United States Centers for Disease Control. The WHO, the World Health Organization, is asked to deal with the whole world with a particular focus on poor countries. And it's really asked to deal with everything. It deals with outbreaks and emergencies through something called the Health Emergencies Program, which is a tiny little thing when I ran it, just about 2003, 2004. But it's built up quite a lot, and it was reformed in 2015 after the Ebola outbreak in West Africa. More staff, different operating procedures. And it was designed to be able to study all outbreaks wherever they occur and to deal with them. And the rules for how it works were set in something called the International Health Regulations. They were revised after the SARS outbreak in 2003, and they were looked at again a bit more recently. But just briefly, these international health regulations establish the responsibilities of countries when they get an outbreak, and they describe the responsibilities of the WHO Secretariat. And basically, the WHO Secretariat is allowed to check for rumors. It's allowed to see what's happening in countries, but it's not allowed to report what's going on unless a country tells it that it has a problem. That's the rules. Countries are in charge. The World Health Organization is not a kind of global inspectorate that can just go into any country when it suspects there's something happening. It has to wait and be told, and wait and be invited. And that's the rules that were negotiated in the World Health Assembly in 2005, confirmed again in 2016. And that's the rules under which the World Health Organization functions. And not everybody in the world understands that. But it's a really big issue. So this year, the World Health Assembly, the governing body of the World Health Organization, met virtually. And the meeting took place over the internet. The Director General spoke, the President of Switzerland spoke, and actually quite a lot of other senior people spoke. The President of France, the Prime Minister of Spain, the Prime Minister of Italy, the Chancellor of Germany, President of Colombia, the President of the European Union, the President of Tuvalu, as Prime Minister, Prime Minister of Bhutan, the President of South Africa, and one or two others. And the reason why I'm telling you this is that all these world leaders, together with the Secretary General of the United Nations, said the World Health Organization is a really important body. It's the body that keeps the world safe when infectious diseases arise. The body that we trust, the body we want to support. They praised WHO for getting personal protective equipment and ventilators and other essentials to poor countries who are suffering because they're short of supplies, because they've all been taken by the rich countries. They praised the WHO for working with the World Food Programme and UNICEF, the children's organization, to set up an airline, chartering loads of jets, big ones, 747s, to move supplies across the world because airlines are not flying. They praised the WHO for linking up with a load of businesses to try to mend the supply failures. They praised the WHO for providing guidance for what should be done about COVID in record time. They praised the WHO for setting up a new research venture to develop vaccines and to find new therapies and to undertake major trials. They really were positive. And they've been trying to find more money, including a $7.4 billion pledging meeting recently for vaccine development. But there's one country that's conspicuously unhappy with the World Health Organization, that yesterday said the organization had been incompetent, had failed, and had not been transparent, even though the organization's been as clear as it can be on what it did from December the 31st, when it first heard about atypical pneumonia, through January, as it found out about this disease, based on information it was given by the country, as it organized to declare the highest degree of emergency that it can on January the 30th, and then instructed governments everywhere that if they wanted to get on top of this, they could, but they had to be ready to interrupt transmission and close down outbreaks as soon as they happen, not with lockdowns, but with really well-organized community-based public health services to detect cases, to trace them, to isolate them, to find the contacts, and to isolate them, and if outbreaks did build up, to suppress them quickly and to shield those who are particularly vulnerable. And that's been the instruction and the guidance. Of course, they can't compel any country to do anything since the end of January. And they said one very important thing. Not only is this a dangerous virus, but it's completely unlike influenza. Do not use influenza models when planning your responses. They said it again and again. But one country in particular is so dissatisfied that they've withdrawn the funding, and they've now sent a letter overnight last night saying that if they're not reforms to make the organisation more independent of one other country, they will withdraw. And that's a great pity, because the people of that country, with whom I've worked for 45 years, do amazing, amazing stuff in public health. And it will be a great loss for the world if that withdrawal takes place. So the Assembly met, and most of those who spoke understood the way in which WHO has to work, understood the realities of the international health regulations. And of course they said, we'll do an evaluation, we'll find out what went on, but we'll wait until the current huge outbreaks have been brought under control. But not the one country that wants to leave. They demanded an evaluation immediately, and they will get their wish. Because in order to get them to sign on to the resolution that was finalized today, everybody's agreed to do an evaluation in the middle of the response. And so that will start now. So I wanted to share with you what I wrote yesterday as the Assembly was starting. I said, across the world, nations are getting ahead of the virus so that economies and societies can thrive. Yet there still seem to be some nations that don't seem to have understood what the WHO recommends. The recommendations are, quite simply, make it hard for the virus to move from person to person. Maintain physical distancing where possible. Get people to protect their faces. Get them to practice regular hygiene. And make sure everybody's involved. Everybody. Use whatever means you can to involve everybody. Music. Radio and television announcements. Dialogue. Because everybody's got to make sense of this new threat and is going to have to change aspects of their behavior to get on with their lives. WHO says, make sure that people know how to disrupt transmission and stop it happening. Stop people transmitting the virus from person to person. Have a high index of suspicion. Detect the disease, if possible, with virus testing, if not with symptoms. And early on, we said loss of smell is an important symptom. We also said the other symptoms, which you all know well, need to be listened to. We said separate people with the disease from others quickly. Don't keep them circulating, waiting for test results. We said trace their contacts. Contact tracing is key. And we said keep their contacts separated, but do it with respect, no stigmatization. We said contain your outbreaks quickly. Don't hang around. That doesn't mean locking down the whole country. We said just simply stop transmission by finding where there's a lot of disease, and yes, preventing movement out of those areas where there's a lot of transmission, so the virus doesn't go to other places. But most importantly, find the people who are sick and isolate them. That's the only thing you can do. And stop transmission if you possibly can. We've said protect the lives of those at risk, and we've reminded that it's poor people who are less easily able to physically distance. It's poor people who are less easily able to isolate. People living in confined spaces. People whose occupations like in factories where they're very close together, or they have tiny, poorly ventilated locker rooms, or they have to sleep in really close contact dormitories. Look after them, we said, because they're at risk. We said, look after older people, because they're at risk. Look after prisoners, because they're at risk, together with the people who care for them. Look after health workers, because they're at risk. And they're mostly women, and they're underpaid. And we said, if you are going to stop movement, do it very carefully, because people will be without money and without work and without food, and the children will get malnourished. And we said, look after those, but keep any cessation of movement as short as possible. Because if you act quickly, if you don't wait, the job's small. If you wait for 3 or 4 or 5 weeks, the virus is everywhere. You've got huge outbreaks, and it's really hard to contain them. And if you do a lockdown, it just freezes the virus where it is. And as soon as you stop the lockdown, it will come back again. So put your defenses in place, we said. We still say it. Don't rely just on apps. Put people on the ground in order to make sure that transmission can be detected and stopped quickly. And so we said, reinforce community health services. It's not expensive. Hire contact tracers. Make sure they're there. Make sure they're trained. Connect them together with health services. And make sure that people know who to get in touch with if they're sick. And we found that the countries that did this have managed to restart their economies quickly. Singapore, South Korea, I've talked about them. But in many developing countries, it's happening. In Costa Rica, brilliant. Colombia, great. South Africa working really hard. India doing the best they can, but struggling because the virus has gotten to slums. And slums are really difficult to control it in. Chile is struggling because the virus is in the villas and slums of Santiago. It's in the villas of Buenos Aires. It's in Lima in Peru. It's in Quito in Ecuador, in Guayaquil or whatever it's called in Ecuador. It's in it's in the city that borders New Mexico, in Mexico country. It's in Mexico City. It's in urban settlements. But where's the virus come from? It's come from the rich countries, because people are still flying out from the rich countries and they're taking virus with them. So we've said, recognize the amazing work being done by poor countries, but we keep asking wealthy countries, make sure you've got your community public health in place. Make sure your people know what you're expecting them. Support them as they take their decisions. Because otherwise, this virus will go on causing mayhem. We're so glad that the support came through at the World Health Assembly. We're so glad that the resolution was agreed. We're so embarrassed that the leader of one very rich nation wrote his open letter last night and made the most incredible accusations, some of which are just not true. So if you hear this narrative that WHO has messed up, just remember that there are many poor countries that are following the advice of WHO that are doing really well. But their economies are collapsing. For example, because markets for their food have broken, their tourism industry is completely destroyed. They're not getting cruise liners coming. They're not getting people coming to holiday. And their farmers are finding it hard to sell their produce because the rich countries were slow. The rich countries didn't get on top of their virus. And that's creating a continued threat for the poor countries. Let's remember that this is all about people. Societies do need to be supported, promoted, reinforced. Employers have a huge responsibility to make sure that work practices are fit for people to live in so they won't get COVID. If you're in meat processing or food processing, or if you're running markets, or if you're in shipping or construction and you've got lots of foreign workers coming to your country to build, you're going to have to look at the conditions under which you force people to live. You're going to have to look at the conditions under which you force people to travel to work. You're going to have to give them the space they need to avoid this disease. And remember, even though not many of them will die, we now know that COVID actually does cause in many people a long illness, a depressive illness. It leads to people being really short of breath when they start exerting. When they're asked to work hard on the factory floor, they may not be able to perform as they used to because their lungs are not working so well. They may end up getting sacked because they're not producing the rate required. So we must remember to ask employers to understand that this disease is discriminating against the poor. Bus drivers, security guards, hotel porters, hospital porters, restaurant workers. They are the ones who are suffering. Deaths among Black people in the US, Asian people in the US, Hispanic people in the US are much higher than they are among the Caucasian population. These are the people who can't work from home. These are the people who need support. So back to the World Health Assembly, back to the evaluation that's been demanded by the member states, back to the row between China and the US. I think it's time for people of the world to just say enough, to actually start to campaign, online petitions, writing to their members of parliament, petitioning their presidents and prime ministers, and just say, this is a global issue. It's really affecting poor people and poor countries so badly. Poor countries are being put into tremendous economic hardship by this COVID, and they haven't got the resources to cope with this, to strengthen their health systems, unless the rich countries provide help. This is the time when we need a Marshall Plan for poor countries. We need the IMF to be fully capitalized. We need the WHO to be given more money, not less. We need the staff of WHO to be given more support, not less. Doing an evaluation now is like in the middle of fighting a big forest fire, stopping the fire engines from being there and starting an investigation of how the fire started. Meanwhile, letting it burn. The withdrawal of funding from WHO is like taking away a fifth of the fire engines because you don't like the fire commander and just saying, tough, you've got to try and fight the fire with less when you need more. It's a bizarre situation. There's no reason to it at all. Every single one of us needs to be working now, not with anger, not with bitterness, not with spite, but for the sake of humanity, to get world leaders to come together. And if one world leader wants not to play, that's a real loss for us because the people of that country are absolutely brilliant. But we need the rest of world leaders to be really strong, support what needs to be done, because this virus is not going away for the foreseeable future. We won't have a vaccine by the end of the year available for everybody. It's a 2.5-year project at the earliest and quickest. We're going to have to learn as humanity to live with this virus, to learn how to defend ourselves against this virus. And the rich countries really have to get it under control, because otherwise they'll go on infecting poor countries who can't afford to shut their borders to people from the rich countries for long because of the impact on their economy. It's an independent issue, and we must get it right. Petitions, media interviews, debates, whatever you can do, whatever anybody can do to make sure that world leaders lead for the people and not for their political parties, not for any particular ideology, but for the people. The time has come. Thank you very much. We have participants connected today from Canada, from France, from the United Kingdom, from Nepal, from China, from the United States, from Switzerland, from Tunisia, and I believe from Egypt. Thank you for being with us. Whether you are just 20 people, 50 people, 100 people, it's lovely to have you here. And we love the fact that our open online briefings, when we post them on the website, are viewed by many. And here in our team, we're here with John Atkinson, Tweeden Nguyen, Catherine Deland, Joe Colombano, who I think is from New York, Magali Mardi, Saber Moumen, Julien Del Montex, and Florence Lasben, the most fabulous team who keep going day in and day out, weekends and weekdays, because we're not going to give up, because this is so important, and because our work is for all of humanity, not for any one country or community or ethnicity or wealth group. And it's so important that we help governments get the narrative right, restore and reinforce public health so they can get their economies working again without being flooded with loads of new cases of COVID with all the consequences. So Tracy in Vancouver writes, and Tracy, are you there? I'm looking for you on the thing. Are you there? I can't see you. Maybe you've got a different name on your computer. Oh, there you are, Tracy. Tracy, hello. Just say your words. You're live. Yeah, we can.
Can you hear me?
Yeah, perfect.
Yeah. No, I can't remember what I said. I'm writing other stuff now.
Okay, I'm going to tell you what you wrote, and then you come back at me. You say, my heart aches at the sniping and violence against public health and safety. Dangerous recommendations and examples exhibited by some people. We need to pay attention and listen to poor countries and their needs. Without saying anything about anybody specific, Tracy, is there anything else you'd like to say?
Well, I just think that the poorer countries, they're much closer to their truth, and they're not distracted by everything that we rich countries have. So, you know, we get distracted with all the things that we have. And so, yeah, and we think we're better than they are. A lot of us think we're better than they are. And so we don't care about them, and we need to.
Thank you. They're doing better in many cases, but they've got less cash. They can't print money. And so there's a real problem that despite the fact they're doing better, they're actually going to be hit worse by this outbreak. Tracy, thank you for your point. That's great. And Iman, you're in Cairo. I can see you on the screen. If you feel like it, I'll watch to see if you do. You can just say a couple of words now. Iman, come on.
Hi, Dr. David Nabarro. I'm pleased to be with everyone live. My concern is about developing countries. Well, I will say that I grew up in the Sudan, and I'm now concerned about some fellow doctors spreading information that is not authentic public health-wise and making recommendations to the public based on that. And another question that I have sent is the surveillance tool, suggesting that we could use influenza surveillance systems. I would appreciate some reflection on that. Thank you.
Thank you, Iman. It's lovely to hear you. Well, first of all, it's very disturbing that there are some doctors who are recommending either prophylaxis or treatment for COVID that is just utterly unproven, and are going on about it and becoming celebrities and having endorsements from very public figures. And we need to do everything possible to stop it. There's a treatment from one country being advertised. It's a tonic based on artemisinin. You might have heard about it. There's a treatment that's used for lupus and malaria that's being advertised as being effective against COVID. And we've now got evidence from studies that have been done that actually it's harmful. And yet it continues to be touted as a kind of joke. We have to be very clear that the only treatments that people should use are the treatments that have been tested. Our colleagues in China have developed really good treatment regimes in Wuhan. They did it very, very carefully in February and March. Our colleagues in the US and in Italy have done a lot of work on treatments. And there are new treatment studies underway for new antivirals being put into place now. Please, everybody, just very carefully, whenever you can, just say, this is not a time to be playing games with people's lives. Only use the right treatments. Now, on influenza surveillance, what's happening is that in many countries that have got an influenza surveillance system, they've been using that as the basis also for doing coronavirus surveillance, and that's very sensible, provided they're using the right tests, either reliable antibody tests to see who's had coronavirus, or using virus tests to see who might have it now, like recent studies that have been done in Iceland and in the UK to look at virus prevalence, prevalence indeed. So thank you, Iman, that you can use these influenza surveillance networks as the basis for studying COVID in populations. Annie Feltham, would you like to unmute yourself? Introduce yourself. Annie Feltham in Colchester, would you like to say your words? It's lovely to see you again after many years. You're live, you've just gone muted again. Could you unmute yourself? Sorry.
Okay. Hello, David, nice to see you again. I listened to what your briefing on Thursday, talking about the full system. I was very struck by that. So coming from a rich country, our system is not fully networked. It's very top down. It doesn't talk to itself properly. So I wouldn't want to underestimate the challenge that rich countries have in dealing with this. And we probably aren't doing particularly well. And I'm just, one question, which is actually, I realize quite a difficult one, is about how do we get over this issue of needing to have a more integrated system? The other question that I was asking is up on the chat is, how do we design a lockdown to interrupt the transmission without causing different problems? Because certainly here, our lockdown was very much a blunt instrument. And I would say that it was a bit ham-fisted, and we have to do better than that.
Annie, I agree with you. A lockdown is really an incredibly blunt instrument when you've got numbers of cases rising rapidly and you haven't got the basic public health services at community level to find people with the disease and to interrupt transmission through isolation and case finding effectively. And so suddenly a government says, okay, we'll stop everybody moving, we'll impose a lockdown. But we in the World Health Organization have never, ever actually recommended lockdowns. Instead, we've said, get the public health right super quickly. But then if governments insist on imposing lockdowns, we've said, use every second of every minute of every hour while you've got the lockdown in place to recruit as quickly as possible people who can be case finders, contact tracers, and who can support isolation and do it really well. Germany did that super fast. Really, in March, they got a load of medical students and they hired them as contact tracers. Singapore did it with airline staff from Singapore Airlines who were not flying, and they asked them to come and help. And they've done really, really well. And if you do it quickly, then the lockdown doesn't have to last too long. The rather bizarre thing about the United Kingdom is the decision was made in March not to pursue with case finding and contact tracing. People thought that it was too difficult. And now, according to what I've read, a huge effort is being made to recruit people to do this kind of very basic epidemiology. But I think it's 5 weeks into lockdown or 6 weeks into lockdown. It's quite late on. And there's not much time left. The commercial pressure to release the lockdown, the public pressure to release the lockdown is bursting in the UK. But without the case finding and contact tracing in place, it's going to be very difficult to stop new outbreaks building up. So I totally agree with you that you've got to design the lockdown with transmission interruption being built up during it so you can release it as quickly as possible. And I just hope that in the UK, these steps that are going to be so necessary can be put in place really, really fast. I noticed a change in the government's tone recently, where they suddenly shifted from saying, we'll do a little experiment in the Isle of Wight to actually doing it across the country. And I wish them well. Thank you very much indeed, Annie. And I am grateful to you for also other work that you've done, which is reminding us that any kind of activity that is designed to shield older people with high risk has got to be done with very great care, taking account of the interests of older people who may themselves not want or feel it's right that they should be shielded in that way, Annie. And thank you so much. And Dr. Raj, I saw you just now, and Raj, I don't know how good your internet is where you are, but if you feel like unmuting yourself, would you like to take a moment to give your comment out loud? I can see you there. Where are you, Raj, first?
I'm in London, Sir David. Can you hear me?
Yeah, very, very well. Come close to your mic. We can hear you even better.
Thank you. I really appreciate your leadership on this issue. My question, I work in the responsible investment and corporate responsibility field, and I'm wondering what company managers, leaders can do if they're in sectors which are particularly at risk, where workers and staff and customers are at risk. I'm thinking about meatpacking, but also other sectors.
Thank you, Raj. I think this is an absolutely massive issue. See, if you're running a big meat processing plant, which is basically from the abattoir through all the conveyor belt towards the packages of meat that people buy in their supermarkets, you're probably running with very tight profit margins. You're probably working with labor. There's mostly people who are super low paid. They may be immigrants who can't find jobs elsewhere, but need the money to be able to pay remittances back home. There may not be very good union representation. What do you do? Because as you know, Raj, the hotspot areas for COVID at the moment do include meat processing plants, particularly in the US, but also in Ireland, I suspect in the UK, in France, in Poland, in Australia. And so there's an absolute need to engage with the employers to create employment conditions that reduce the risk of transmission. My own view is probably in the locker rooms, in the bathrooms, in the restrooms, or in the places where workers are very close together and physical distancing is not practiced, that the transmission is occurring. And I really believe myself that it's absolutely incumbent on the employers to improve the work conditions to reduce the risk that people are getting the disease. And I have to keep reminding people that COVID is not a mild illness. As you all know, and as I said just now, younger people in their late 20s, early 30s, mid 30s are getting COVID, and they're finding that they get short of breath for many weeks afterwards, or they get super depressed. So it really is important. Raj, you know that people who work in the checkouts of supermarkets, or as security guards, or as hospital porters, or people working as drivers in the buses, and of course people working in care homes are more at risk. They're all low paid. They're often non-unionized. People in care homes are very low paid. In the UK, it's £10 an hour work. And they're often doing multiple jobs to try to support their families. In the care homes, they're almost all women. So of course, there is a huge need for employers to be responsible. But in this era we've got now, where government policy has been to deregulate or to encourage self-regulation, there are changes happening in many of these sectors. And so it's necessary to try to combine the political push to reduce regulation with creating a sense of responsibility among employers, that they're creating places that are really unreasonable in terms of COVID. And I think we have to, as you've suggested in your remarks, find the corporate leaders who are really setting an example, the care homes that are showing ways in which they can get people to be providing care without running the risk of either making themselves sick or, better, but even more importantly, making those who they look after sick. And people like me, I think, have a responsibility, but all of you too do as well. Any way you can find to do this, please let me know. I'm going to do a narrative on the responsibility of employers to create safer working circumstances. But I don't have a huge readership of my narratives. But if any of you find ways in which we can get the message across, please let me know. And I'll try to find ways to weave it into any media interviews that I'm doing in the near future. Because like you, Raj, I've got really affected by this. I hope that's some use as a comment. If you want to say anything else, Raj, come in now. You're on mute, yeah.
Very, very clear. Thank you, Sir David. I think one of the audiences for your messaging should be the investors.
Yeah.
For example, private equity investors have a lot of sway over social care homes. The large index fund managers have a lot of sway over some of the meatpacking companies. A lot of these investors claim, and I think intend to be responsible investors, but they're not really sending a message to the management of these companies. And I think that they could be doing more.
Thank you, Raj. That's a really good tip. And we, by some fluke, we have some contact with some of these people. We have to do a little pushing to open up the contact. But I've been very impressed actually with Larry Fink and the position he's taken on ethical investing in BlackRock. So I'm not sure I can necessarily contact him, but I will follow up. That's a great idea. Thank you. Now, Karen Kaplan, I think. Karen, are you on? Let me just look for you. If you are on, Karen, could you unmute? Here you are. Can you unmute? Here you are.
I'm unmuted now, but I think it's very windy where I'm at.
No, you sound fine. We can hear you, Karen.
Oh, okay. Hi.
Anything you'd like to say, Karen?
Well, my question that I posed to you is, I guess I can't necessarily say everything
No,
on a
it's a long
live.
question.
well, it's maybe not long, but it's also, I need to be a bit privacy and protocol. A few months ago, on behalf of a philanthropist, I was engaging with WHO in Tedros's office and learning about the new foundation that's about to be launched.
Yeah.
And learned that there's going to be, you know, a core committee. At that point in time, it might be quite different now, I have no idea, but at the time there was about to be like 10 to 12, a dozen people who would create like $1 billion, not endowment, but $1 billion launch of the WHO Foundation. And my question really is, do you think it's possible to talk to Godans and the doctor, I know who he is, who's been appointed to lead the foundation? Can we, because I am American, American citizens are absolutely outraged. The majority, not all of them. Obviously, you see all the others who, in their whatever kind of other outrage, are presenting some other largely false narrative for this nation. And the global health role that this country has always led is beyond at risk. It's fallen. We've fallen down on the task with this current administration. I'm wondering, because of your connection, is it possible to propose a U.S. committee, or whatever, like a better name for them, of major donors who will make up for the financial loss of the U.S.'s commitment right now, just immediate, and make them a permanent member of the WHO Foundation? But there's this one committee that's like whatever, the core committee that was supposed to happen, but then there was also supposed to be others. But at this point in time, given last night's 4-page nonsense that was sent from this current president, which, by the way, voting will happen soon here and he will not be, but in the meantime, let's just like stay focused on what we need to stay focused on, and it's financially supporting WHO and everything. And there are so many wealthy, there's so much incredible wealth here. Do you think we can promote this to the foundation to say, create like a also U.S. in support of WHO committee, or founding committee, U.S. in support of WHO committee, founding committee inside the foundation. So that's it.
So let's make it the US for WHO. Count me in. There's somebody called Elizabeth Cousins who's in the UN Foundation in Washington. I'd love you to connect with her if you haven't done so already. But most importantly, make sure you connect with us. And we would like to do everything possible to support this venture, because I agree with you. US has been an extraordinary leader in global health on so many issues. Reproductive health, big time. Communicable disease, big time, especially malaria, HIV, tuberculosis, but also dealing with outbreaks. All my work, early work on outbreaks, was very beautifully supported by the United States. So let's try to make that happen, Karen. Please stay in touch, and I would love to follow up with you. That's a brilliant suggestion. US for WHO, why not? Thank you. Kathy Matthews, are you on? Where are you? Sorry, I have to keep looking around to see where people are. If you're on, and you can unmute your phone, could you do so?
Can you hear me?
Yeah, perfectly, but you're quiet, so really come close to your mic.
Hi, everybody, and thank you so much.
Still
David.
quiet. Either shout like anything or come very close.
Hi, everybody. Thank you very much, David, for your ongoing weekly support. It's just tremendous. I've had a number of comments that you can see in the chat, but relevant, probably, and the most important contribution would be two of them. The first is there an opportunity for the World Bank or WHO to issue social bonds where in exchange for interest, companies would receive social credit for lending money? And the second is, are we seeing any progress at all on any of these plant compounds being studied in terms of the efficacy, peppermint, thyme, and of all things, a Canadian flower that were shown to be incredibly efficacious in avian. And I know it was in vitro and it was avian, but we've had some time to look at it now. Thank you.
So Kathy, thank you for the comment about the plant compounds. I know you've been interested in that, and then I've been remiss in not getting back to you, but I will try to do so. But secondly, I think it's a really good thing, this bond idea, and we'll take this one up and we will try to see whether or not there is any interest. I think I know how to reach you, and so if I get anything, I'll follow up. Occasionally I miss emails, so don't hesitate to badger me a bit with if you want, and we will follow up. Kathy, thank you for the plant compound idea, though. That is really important. And by the way, some of you may be seen also the possibility of vitamin D. That seems to be gaining a lot of interest. We need to get the studies done, but very, very important. Thank you. I'm actually just going to now go back into the more normal thing because we've got a lot of questions and I'm being too slow. But Chris Underhill from Think the Unthinkable, I think it's Chris, how can the petition by the One campaign help to create the global pressure on leaders? Well, we need a lot of petitions because we need about 500 million signatories. We need an enormous number. We need to get up into the millions, and it needs to be a lot of million to really make a difference. It's got to be a very, very large petition. Obviously, it will never get to that number. It might be in the 1 millions or 2 millions, but it's got to be calling on global leaders to work together in unity for the sake of the future of the world. And it's got to come quick, and it's needed very, very urgently. And we need to talk to the One people to get them to really up their ambition. But there are other groups as well who are working on this, and I think we need to encourage One to link up with Global Citizen and to link up with a number of other groups, so we end up with multiple petitions that coalesce together with the same language, calling on leaders to lead for the people rather than to lead for their political parties or for their own national interests. And it's got to come really, I believe, quite soon. So Chris, I mean, it's a pretty unthinkable thing to think about, but I'd love to work with you, and I think we'd all like to work with you on trying to create a networked petitioning process for global citizenry, just to ask the leaders of the world to just get themselves serious about uniting on it. We'll follow up with you. Thank you. Kathy says, number 7, Kathy Matthews again, if everyone were required to wear masks, how effective would this approach be? I think it's the only sensible thing to do, especially on public transport, especially in places where physical distancing is impossible. Obviously, there'll be some people who just can't bear wearing masks. Well, then they mustn't. But I think most people can. I think we should be wearing masks that are not necessarily made out of this very constraining high filtration material that makes us look a bit strange. We can just wear ordinary face coverings. That greatly reduces the chance, especially if you've got the virus, of transmitting it, if you're asymptomatic, but also it's believed to reduce the chance of getting it. And I can't understand why there's not now an evolving world requirement for people in public places where they are close to be wearing masks. It's just, I cannot get it, because I find myself just feeling that leaders are not taking the interests of their citizens seriously. And we will learn to love ourselves wearing masks. We'll learn to smile with our eyes. We'll learn to wear masks that can convey messages. It will be something that we have to do. And anyway, that's what's done in many countries now already. And it's just this, some extraordinary, I don't know what it is, peacocking pride by some leaders to say, oh, well, we're going to do different. We're going to follow different rules. We're all learning. Why don't we learn together? And then if we find we're all making a mistake, then quickly we change. But it just seems bizarre that we've got all these unplanned experiments underway. I don't know. And then why are we not seeing huge outbreaks in airline pilots and flight attendants? I don't know. And there's something about air travel that seems not to make it so bad. There are reports of occasional cabin crew illness, but airplanes seem to have a very high air circulation compared with ships where the crew are in quite dense circumstances, or compared with the locker rooms and many factories where people have no ventilation and are very close together. Ventilation has a lot to do with transmission, I think, Kathy. Anita, I see you there. Anita Bake, question 8. I'm not going to force you to unmute yourself. I just want to look at you if your video's working. Does your video work? Well, anyway, if it doesn't, is WHO tracing the misinformation being shared about WHO and trying to stop these? Anita, yes. Yes, and I don't know whether you've looked at it, but the WHO website has gone very much out front with giving good video timelines of what happened and doing a lot of good stuff. But the trolls who are producing the most incredible vitriol against WHO staff, particularly Tedros, but I think because he's African, it's just extraordinary. I've used the word grotesque to describe it because I think it is. We need to do more on misinformation, but it won't be done by WHO. It's got to be third-party affirmers, and people do need to find some way in their hearts and in their souls to believe that this is not a conspiracy between WHO and China. I know that. I was in WHO at the time when the public health emergency of international concern was declared, but I was involved in SARS and I was involved in Ebola. You can't simply scream at presidents and prime ministers and say, we don't trust you, and then expect them to share data. You have to be decent to them. You have to treat people with respect, even if you think they might be hiding stuff, because then it just is just not right. And now I want to do one more thing. I want to talk to Dr. Saad Vakas, based in Morocco. He's from Multipod Mentoring. Hello, Saad. There you are. Thank you for showing us yourself. You want to know how to engage more. You're one of 2 medical students who want to do a write-up of the briefing. You're unmuted, Saad, so welcome. I hope you're okay. You're probably fasting, so you must be tired. Good to see you not looking too bad. Do you want to say a word or two, Saad?
Thank you very much, Doctor, for giving the floor. So yeah, great pleasure for me to be here. And personally, I'm the coordinator of the International Federation of Medical Students Association's COVID response internationally. Yeah. So now we're having more than medical students working in more than 95 countries, trying to take action, raise awareness, support the government, etc. And one of the, or 2 of the issues that we've been facing a lot, and those are quite coming along with the population, is first health literacy and all the misinformation. And in some countries, even the authorities are spreading those misinformation. And the second issue that we were facing or struggling with is how to support young people, and not only from the health sector and mental health, but also from the economic sector and perspective, kind of empowering young people and under those circumstances. So any advice in that field would be much appreciated.
So just one thing, welcome. Younger people will pull us through this. Younger people will see the nonsense of the global situation we have at the moment. You want the world that's fit for you, for your children, and for their children. And you should be bringing us along with you. We'll do anything we possibly can to support you. Special webinars for members of IFMSA or anything else that we can do to be helpful. Because I used to be a member when I was a young medical student, and I think it's the most brilliant, brilliant federation. So just call on us. We'll do what we can to support you, Saad. Thank you very much indeed. Please join us on the briefings. If you can't join us, tune in to the webinar, to the recordings of the webinars, but don't hesitate to be in touch with myself or with Twee or any of the others in the team. we will do everything possible, not just for COVID, but to help you, because you are taking this broad, multi-sectoral perspective, the one that we're advocating from my role in Imperial College. Thank you, Saad, very much indeed. Shukran, thank you. Now I want to go a little surprise, and if you don't mind staying on just for perhaps 3 or 4 minutes, I'd like to show you something that's come out of one of these online briefings, and it came as a surprise to me last night. I want to first credit Derek Owen, Vijay Golnick, R. Jane, Jeffrey Daniels, Sophia Nicolini Rocha, Alger Nakria, and Thalreed Sharan, PA, plus Nazim, who's very important in this, and Vicky Doyle, who's also very important. What they have done is they've put together a video using a song that Nazim wrote after he'd participated in some of our work and read one of our narratives. And this video has then been developed based on Nazim's song by another person who participated in some of the briefings, Derek Owen, who happens to be a friend of one of our team, but through some amazing miracle of joint working all across the world, through huge networks, they've done something that they're going to launch very soon, and you're going to be the first people to see it.
Nazim, COVID-19 is real, my people. We have to stay inside and wash our hands every time. COVID-19, oh, it is real. It is real, oh, it is real. People dying, oh, everywhere. People crying, oh, everywhere. People suffering, oh, everywhere.
People are coming to terms with the reality that this virus is here to stay and it is dangerous. Needs a whole community response to defeat it. Basically affects everything that we do.
We don't want to suffer more. We don't want to struggle more. We don't want to suffer more. Living like this, we don't want to suffer more.
What I want to stress is that in dealing with a problem that is affecting 7.8 billion people and that is associated with huge inequities, there's one thing that really matters, and that is that we all work together as a human family.
We got to be ready. Let us make ourselves ready. COVID ready. COVID ready. The choice that you make now can decide the future. We don't want to suffer more. We don't want to struggle more. Don't want to suffer more. Living like this. We don't want to suffer more. We don't want to struggle more. We don't want to suffer more. Living like this. Yes, we can. Together.